So, hello everybody. My name's Jill. Today I've got with me Krishna Mistry, and she's going to offer us a career case study interview. So, hello Krishna and welcome.
Hi, nice to be here.
And could you just tell us a little bit about yourself? Just give a little introduction to you.
So I have been a RVN for the last 9 years. I work in a busy small animal hospital in West Yorkshire, and I'm one of the medical nurses there.
Oh, cool. Thank you. So tell me a little bit more about the role you perform, and you sort of said where you work. So maybe give a rundown of a typical day at work. What sort of things might happen in a typical Krishna day?
So where I work at the moment, we cover the out of hours provider for about 15 other practices in the area. So it can be very busy and varied. So normally in the morning, we take a handover from the night team. We average, I'd probably say, about 10 to 15 inpatients a day. And then sort of from the get-go in the morning, it's making plans with the inpatient team and with the vets and the surgical team and deciding the plan for the day for all the inpatients that are in. And then it's sort of updating the clients on what's happening with the patients and making sort of the further medical and nursing plans for them going forward. So it can be busy and it can be varied. Like I said, we are at the moment in the midst of getting an expansion as well. So it does get a bit manic at times.
Yeah, I was just going to say that does sound very busy. I know from my own experiences, even if you've got a couple of inpatients, it can be really hectic. So yeah. But I imagine that's something that you really like about the role as well, that it's busy and there's always something happening.
Yeah, definitely. It's one of the main reasons that I ended up staying there. So originally I was a locum, and then they stuck to me to get a permanent job, but it was the fact that they are so busy and so varied, and you see things there that I've probably not seen anywhere else, and they're really supportive of the nursing team as well. We've got a good variety of people that have got a special interest.
Yeah. So what do you think is if you had to sort of say what's the best part of your job, what do you think that would be?
I think it's sometimes when I get that 2 minutes to sit in a kennel and just spend time with the patient, because sometimes it will be crazy, busy, everyone's running around, but taking that 2 minutes out, we have little iPads that sometimes we put in dogs' kennels if they're a little bit anxious, which is quite nice, and sort of sitting with them, and even like cats, brushing cats and making sure that they're getting fed. And I think that's really important. And I think it's something that's quite overlooked in nursing. I think especially the further that you progress into your career. But I think that's sort of like the bare bones of being a nurse, is that caring side. That's the bit that I like the most.
Yeah, I totally agree with you, Krishna. I think it's that real basic actual nursing care, isn't it? Really like one-to-one with the patient, and we can kind of get caught up in all the technology and the diagnostics and the drugs that we're using and everything, and that just one-on-one time with the patient is just really important, isn't it?
Yeah, definitely.
So before we started this interview, you were just saying that you're going to the Emergency and Critical Care Conference. So just tell me very briefly about that. Is that something that you do every year, or?
So this is my first year going. I've always had sort of a bit of an interest in sort of emergency critical care. I did my certificate a couple of years ago now in the midst of COVID. So I missed out on the conference then. And this is my first year going. And I have just done my postgrad vet nurse certificate in emergency and critical care, which I'm awaiting results for. So I really do like that side of nursing. I find it a nice mix between like the surgical and medical sort of idea of everything, and sort of looking after patients that are like in ICU and things. I really enjoy.
Yeah.
So I'm excited to see everyone and see if there's anything new that I can learn.
Yeah, that's always part of a conference, isn't it? Is talking to
Yeah,
other nurses and vets and sharing ideas and stuff. Yeah. But
yeah.
so I can see that you're really keen to like develop post your veterinary nursing qualification. That's great.
Yeah.
So tell us about any sort of challenges that you faced in your role so far.
I think especially when I was newly qualified, I think it is that time, it's something that comes with time, sort of like gaining confidence. I often didn't sort of voice my opinion or my ideas because I sort of felt like, oh, I'm a vet nurse and I shouldn't say things, and the vets are having their discussion and they make the plans. But as I've sort of furthered on into my career, I've realised that as nurses we're really important and that we should be happy and confident enough to voice our opinions and our views, especially because we spend so much time with the patient. So definitely, as I've sort of progressed, I feel like I'm a little bit more confident to say how I feel and what I
Yeah.
think that should the next steps be.
Yeah, it's such an important aspect of nursing. I think that nurses are able to give their clinical opinion and have a to play in that process of clinical decision making as well. But like you say, when you first qualify, you first registered, it's difficult to have that confidence, isn't it?
Yeah,
Yeah,
definitely. I
yeah,
can't imagine. I think seeing myself now, I couldn't imagine myself being in this position. Um, and I try to encourage like the nurses that I work with now that are quite newly qualified to sort of be brave to voice your opinion because it does matter and people do take it into consideration.
yeah. No, that's really good advice. So, if you had a key piece of advice to give to somebody who maybe aspires to a similar role to you, what would that piece of advice be, do you think?
Um, I think just believe in yourself. I think
Yeah,
especially at first I wasn't sure that. I think through my training sort of period, it was quite difficult and I wasn't sure what this was the right path for me. And luckily, I was surrounded by nurses that were supportive. And I think they gave me a lot of confidence. But I think just believing in yourself.
yeah,
And it's as much as you have those days when you whinge when it's been busy and you've not had a lunch break and things like that, I couldn't imagine myself doing any other job, to be fair. I really,
yeah.
really do love it.
Yeah. Oh, that's good to hear.
Yeah.
That's good to hear. So what plans do you have for the future then, Krishna? Anything sort of apart from your ECC conference and getting your results from your Cert AVN,
Um,
what do you have planned?
so I have been sort of doing external courses for the last 6 years, I think I worked it out. So it all sort of depends on my results, which hopefully should be this week or the beginning of next week. Um, but I might go back to uni and do a certificate in anaesthesia and just have a bit of a change. I am a little bit of a sucker for all the extra personal knowledge. I think I tell everyone else I just like graduating. That's mainly it. I like taking my mum to all these graduations. So I think that's my next step is that I'm going to have a look at doing the anaesthesia certificate. And I've been in talks at work and things about sort of doing internal CPD with all the student nurses and the other nurses and trying to get like a journal club and things set up at work. So they're my next sort of steps that
Oh, that's
I'm looking forward to.
fantastic. Yeah. Sharing some of your newly acquired knowledge with some of
Yeah.
the next generation of vet nurses. That's
Mhm.
great. Well, thanks very much, Krishna. That's really, really helpful for you to share your story with us. And I hope to chat to you again sometime soon. Your interview will be on the VM Futures website, and everybody will be able to enjoy it there.
Thank you.
All right, thanks very much.
Thank you.